It's scary for someone to tell you, you have a melanoma. Our clinic will address both your physical and emotional needs. We will take time to talk to you and be with you throughout this entire process. Additional individual and family support is also available through our melanoma support groups, social workers and psychiatrists. You and your family may have questions about melanoma, such as, what exactly is melanoma? How common is it? Who's at risk? What does melanoma usually look like? And how is it treated? First, what exactly is melanoma? Melanoma is the most dangerous form of skin cancer. It begins from a skin cell called the melanocyte. Melanocytes are normally located throughout the skin and produce melanin or pigment. Melanin or pigment is produced by these cells when exposed to sunlight as part of the tanning process. Regular moles contain groups of melanocytes. Melanoma begins when an individual melanocyte loses its ability to regulate its own growth, like a copy machine with a broken counting mechanism that continues to make copies even when you keep pushing the stop button. With time, the melanoma continues to grow. The earlier you find it and the thinner it is, the better the chance of a complete cure. How common is melanoma? The number of new cases of melanoma is rising faster than any other type of cancer. It's the most common type of cancer in women in the United States 25 to 29 years of age, and the most common type of cancer in men in Michigan 25 to 44 years of age. To put it in perspective, 1 in 1,500 people born in 1935 will develop melanoma during their lifetime. 1 in 600 born in 1960 and 1 in 75 people born in the year 2000 are projected to develop melanoma over their lifetime. So if you have young children or grandchildren, they're at higher risk due to the year they were born. Other risk factors include a significant history of sun exposure, especially a peeling or blistering sunburn during childhood, greater than 100 normal moles or several atypical or unusual moles, blonde or red hair, blue eyes, or fair skin, already having a melanoma. About 5 to 10% of people who develop one melanoma will develop a second one. The risk of additional melanomas is lifelong and may occur anywhere on the skin. Therefore, lifetime follow-up and a complete skin examination is recommended. And lastly, any blood relative is at higher risk if one family member has a melanoma. Genetic counseling is available in our clinic if desired. What does melanoma usually look like? Melanoma can appear suddenly as a new or changing spot, or can develop slowly in a mole or on normal skin. The ABCDs may be useful in recognizing spots suspicious for melanoma. A stands for asymmetry. When you cut this mole in half, it looks different on each side. It's asymmetrical. B is border. We look for a jagged or scalloped border. C stands for color. We look for jet black or shades of red, white, or blue. And D stands for diameter. Diameter greater than 6 millimeters, about the size of a pencil eraser head, needs to be examined. While the ABCDs of melanoma are helpful, early melanoma may lack these signs. Early detection is most important. The earliest sign of a melanoma is a change in the size, shape, or color of a mole or a spot on the skin. The earliest symptom, although most don't have it, is persistent itching for no apparent reason. Therefore, any mole or spot on the skin which is changing its size, shape, or color, or is persistently itching, especially in a person at risk for melanoma, will usually need to be seen by a healthcare professional and possibly tested. Melanoma may spread from the skin to other areas of the body in several ways, the most common being through the lymph system to the lymph nodes. The lymph nodes filter fluid and cells draining from the skin back to the heart. If a melanoma cell breaks loose, it may be trapped in the lymph nodes and at some point begin to grow as a lump. The common lymph node groups that need to be examined are located in front of the ears, the neck, above the collarbone, under the arms, and in the groin. We'll examine your lymph nodes by feeling for abnormalities. We will also take the time to teach you how to perform a self-skin and lymph node exam, which is something that you should do every month. What about treatment? For melanoma that has not spread beyond the skin, an area of normal skin around and under the melanoma will need to be surgically removed to prevent the melanoma from coming back in the same spot. The amount of normal skin that needs to be removed depends mainly on how deep the melanoma is. This procedure, known as a wide local excision, usually takes from 30 minutes to 3 hours, depending on whether surgery will be performed in our surgical unit treatment room or the main operating room. We divide melanoma into thin, in between, and thick, depending on how deep it is under the microscope. Less than 1 millimeter is thin, 1 to 4 millimeters is in between, and greater than 4 millimeters is thick. The risk of melanoma showing up somewhere else in the body increases the deeper the lesion gets. While these numbers representing tumor thickness aren't magic, they help guide us to develop the best overall plan for you. Sometimes, special tests and procedures may be done to try to find melanoma in other areas of the body. The risks and benefits of these procedures are taken into account for each person and will be explained to you. If melanoma is found in another area of the body away from the skin, treatment is usually directed towards that area. New discoveries and guidelines are continually being developed for melanoma. Our melanoma specialists are on the leading edge and are familiar with these developments. Usually in one visit, with input from all of the specialists needed, an individualized, comprehensive treatment plan can be developed and explained to you and your family. We hope that this video has given you a better understanding of melanoma and what to expect from our clinic and your consultation visit. When someone says cancer, that can be frightening. We understand and will be with you through this. Our mission is simple. Each and every patient should be treated like our own family member.